And we have seen a lot of videos on knee arthritis in my channel. But one of the most common questions that I encounter is there a hip arthritis? Why we always talk about a knee arthritis, not the other joints? So this video, if you ask me, is there an arthritis that involves a hip joint? My answer is yes. Hip joint arthritis is not as common as a knee arthritis, but definitely it's the second most arthritis, I would say. It's very common in the European nations, predominantly in the British, where we call it a primary hip arthritis, where you don't need a reason, but it comes naturally as the aging process, just like how we have a knee arthritis in our country. So there are two categories, if you say. You have a young people who have an arthritis of the hip joint, and then elderly with the hip arthritis. So technically in India, we call always a hip arthritis a secondary arthritis. Like you get an arthritis secondary to some other event, unlike a knee arthritis. So in a young patient, it's most commonly a condition called avascular necrosis of hip, which is AVN hip, where the blood supply to the hip joint is compromised due to some unknown reasons, but there are various theories to say this could be a reason, but still we cannot pinpoint one of the reasons. So in that scenario, the blood supply to the femoral head, the ball and socket joint, the ball part of it, the blood supply is compromised, and thereby it becomes deformed like a mushroom shaped, causing an arthritis. So who all are prone to this hip arthritis or the compromised blood supply to the hip joint are people who are on steroid. Could be because of a skin disease, and now most commonly see as a sequelae of a COVID time when they are admitted in severe respiratory distress and they were on steroids. Very unusually I've seen even in pregnant women who have been given steroid shots. Second is alcohol abuse. People who have consumed more than at least 3 alcohol sessions a week are very prone for hip AVN actually. And sickle cell disease, certain blood dyskaryosis, where the red blood cells in a different shape, they can cause the blood flow obstruction. And some other conditions like Caissen's disease, where the people go under the water in a deep sea, where the pressure is built up, they can also have. So they are very, very, very finer conditions, most prone for hip AVN. Most commonly what you have to remember is people who are on alcohol abuse or people who are on steroid. And now this particular people have a hip pain, and when you meet the doctor, they test you, they find your hip range of movement is restricted, and that becomes a significance. You will take an X-ray. When you see an arthritis in an X-ray in the hip joint, you are already missed the boat. It's too late. Ideally, the X-ray should appear normal, so your doctor will, under just a suspicion, he'll send you to an MRI. If the MRI shows an AVN, then at least we have some chances of treating it. There's a classification called Ficart and Arlett classification, which classifies the hip AVN into 1, 2A, 2B, 3 and 4. Anything less than 2A, we have chance to preserve your head, which means you can do something to stabilize your head. Anything about 2B technically will end up in a hip replacement. So what are the options do we have to preserve a hip joint is something called core decompression and bone marrow injections. You do a core decompression to sort of depressurize your hip joint, and you get a gap for that. You take your stem cell from your hip joint, inject into that hole and make it heal faster. But anything above 2B definitely will end up in a hip replacement surgery. Now the second group, which is an elderly population, say around 60, you have a hip arthritis. They usually end up at the end stage, like stage 3 or 4, where it is not a secondary but a primary osteoarthritis. In that scenario, most of the time, they will need a hip replacement surgery. There are in-between games. There are options where you can take medicines, try to postpone, stuff like that. But invariably, when the stage is terminal, it ends up in a hip replacement surgery. So if you think hip doesn't get arthritis, you will be wrong, because hip arthritis is slowly catching up, and we don't know, like last 50 years back, it was unknown in India. Now we are definitely talking about it more common. Probably in another 50 years, it can be on par with knee joint. So we're not sure about that, but definitely hip arthritis has to be taken care of. So if you do have a hip pain, even at the young or elderly, please visit your doctor, seek their advice, investigate, and get back to your day-to-day activity. If you like the video, please click the like button, share it for the people who think it will be very useful, and please drop down your comments below. Thank you.